I'm a pediatrician, and one of the most common reasons that I see patients in the office is for cough, usually from a cold or otherwise known as an upper respiratory tract infection. In this video, I'm going to share with you a few ways you can help your child while they're recovering from a cold. So the first one is hydration. So you're going to want to keep your child hydrated. In babies, you can use formula or you can use breast milk if they're breastfed. You can also use hydration solutions such as Pedialyte. The most important thing in babies is that you don't want to use just plain water to keep them hydrated if they're refusing the milk. So you always want to use either milk or something that has electrolytes. And in babies, well, that would be Pedialyte, which is very good at hydrating them and also providing them with the necessary electrolytes that they need. In older children over 1 year old, if they are refusing solids, you can actually give them plain water, you can give them diluted juice, electrolyte solutions such as Gatorade, even Pedialyte. So you have a little bit more options, but you definitely also need to keep them hydrated throughout the course of the illness. In kids older than 1 year old, a great natural remedy for the cough is honey. I usually recommend 1 teaspoon every couple of hours as needed. A lot of the cough is actually caused by something called postnasal drip. So what that is when excess mucus in the nose drips down the back of the throat and causes the cough. So one way to help with that is by keeping the nasal passages clear. So in babies, small children, you can use saline sprays that you can purchase over the counter to spray the nose and keep the nose clear. You can also suction the mucus as needed using a bulb suction or a nose frida. In older children, you can actually irrigate their sinuses with devices such as the Netapod or the Neomed sinus rinse. Make sure you use distilled water or sterile water by boiling the water before you use it. For those of you who live in cold climates, the air can be pretty dry around this time of the year, especially from indoor heating. So what you're going to want to do is use a cool mist humidifier when your child is sleeping. That way, that's going to add some moisture to the air, and that's going to loosen the mucus in the nose, and that's going to ease the nasal congestion. If your child has a fever, you can use acetaminophen or ibuprofen in babies over 6 months of age to keep them comfortable. If your child has a fever that's lasting more than 5 days, you want to take them to their primary care doctor to get an evaluation to ensure that there's nothing else going on.